Pregnancy is a time of joy and anticipation, but there's a hidden condition that's becoming more common: gestational diabetes. Many know the name, but few realize its impact can last well beyond pregnancy, affecting a child's future health and development. Recent research links gestational diabetes to higher risks of conditions like autism and ADHD in children. This isn't about alarm, it's about empowering families with knowledge. Gestational diabetes is high blood sugar that develops during pregnancy and usually resolves after birth, but its effects can linger. The focus is shifting from immediate risks, like larger babies, to subtle, long-term effects on a child's developing brain. While gestational diabetes doesn't directly cause neurodevelopmental conditions, it increases vulnerability during a critical time for brain growth. Understanding and managing this risk is key to ensuring a child's lifelong well-being. Let's explore what gestational diabetes is, why it matters, and how you can take action for a healthier future. Gestational diabetes is a type of diabetes that appears during pregnancy, caused by hormonal changes that affect insulin. For most, blood sugar returns to normal after delivery, but the condition is on the rise, now affecting up to 1 in 10 pregnancies worldwide. Factors like older maternal age and higher rates of obesity are driving this increase. The risks go beyond pregnancy. Mothers face a higher chance of developing type 2 diabetes later, and babies can be born larger or with low blood sugar. More importantly, exposure to high blood sugar in the womb can increase a child's risk of obesity and diabetes later in life. This cycle highlights the need for awareness and prevention. Managing gestational diabetes isn't just about a safe birth, it's about shaping lifelong health. The in utero environment plays a foundational role in a child's future. Breaking this cycle starts with understanding and action. The latest research focuses on how gestational diabetes affects a baby's brain. High blood sugar in the mother leads to high blood sugar in the baby, creating a stressful environment that can disrupt brain development. Studies show links between gestational diabetes and increased risks of developmental delays, ADHD, and autism spectrum disorder. The reasons are complex. High blood sugar can be toxic to brain cells, trigger inflammation, and disrupt the flow of vital nutrients. The developing brain is especially sensitive during pregnancy, and even subtle disruptions can have lasting effects. Managing gestational diabetes is about protecting the blueprint of your child's neurological future. Early intervention can make all the difference. Early detection is crucial, and screening for gestational diabetes is a routine part of prenatal care. The glucose screening test, usually done between weeks 24 and 28, is simple and effective. If results are high, a follow-up oral glucose tolerance test provides a clearer picture. Certain women are at higher risk: those with a history of gestational diabetes, higher body weight, family history of diabetes, or conditions like PCOS. Ethnic background and age over 35 also increase risk. Knowing your risk factors helps you and your healthcare provider stay vigilant. Proactive screening means problems can be caught and managed early. Early action leads to better outcomes for both mother and baby. Awareness is your first line of defense. A gestational diabetes diagnosis can be overwhelming, but it's manageable with the right steps. The foundation is a healthy lifestyle, balanced nutrition, and regular physical activity. Work with your healthcare team to create a personalized plan focused on whole foods, lean proteins, healthy fats, and complex carbs. Eating smaller, more frequent meals helps keep blood sugar stable. Gentle exercise, like walking or prenatal yoga, improves insulin use and supports blood sugar control. Sometimes medication or insulin may be needed. This is common and safe. The goal is always stable blood sugar and a healthy environment for your baby. Every positive choice you make supports your child's future. You have the power to shape a healthy pregnancy. With extra attention and care, most women with gestational diabetes have healthy pregnancies and thriving babies. The key is early screening, active management, and building healthy habits that last beyond pregnancy. These habits reduce your own risk of type 2 diabetes and set a strong example for your family. Lean on your healthcare team for support and guidance. Monitoring your blood sugar becomes routine and empowers you to make informed choices. Remember, a diagnosis is just one chapter, not the whole story. With consistent action, you can lower risks and give your child the best possible start. Your dedication today is a lifelong gift to your child.